Heel pain is a very common condition that I treat every day here at Traction Podiatry. Many times patients will come in with heel pain and assume that they have a condition termed plantar fasciitis, since a quick Google search of heel pain will result in the diagnosis of plantar fasciitis. Although the majority of time the heel pain is commonly plantar fasciitis, it's important to come to clinic and make sure that the heel pain isn't something more serious, such as a nerve entrapment. We will obtain x-rays to look for bone spurs and any other skeletal anomalies that could be causing some of the heel pain. After a clinical exam, we will discuss how to move forward with treatment. Not every case of heel pain is the same, and each patient has unique nuances that need to be considered to formulate a customized treatment for each patient. If you are experiencing heel pain, I would strongly advise you to make an appointment and allow me to comprehensively work up your heel pain and provide treatment options that work. If you aren't quite ready to come in, these next few videos are going to teach you some easy stretches and mobilization techniques you can do at home without any special devices or equipment, as oftentimes this condition, if treated early, can be easily fixed with regular and consistent stretching and mobilization. So let's go through your morning, afternoon, and evening routine if you are experiencing acute heel pain. So first, your morning routine. For most patients with heel pain, the first step out of the bed in the morning is the worst part of their day. Mustering up a mountain of courage to take that first step out of bed is not how anyone wants to start their day. To help make that first step easier, we're going to spend 3 to 5 minutes gently and lightly massaging directly at that point of maximal tenderness, as well as some of the surrounding tissues. You use your thumb and start working your heel and work your ways out towards your toes. Move slowly and deliberately as your thumbs make their way to your mid-arch and extend to your toes. Repeat this for 1 to 2 minutes. Next, we'll focus on the posterior leg. Use your thumb, the adjacent finger, slowly and deliberately move down your calf to both sides of your Achilles down to your heel bone. Once you reach the end of your Achilles tendon, slowly circumduct your ankle clockwise and counterclockwise. Repeat this 1 to 2 minutes. These two stretches and triggered mobilization will not only bring more blood flow to the area, but they'll help wake up the tendons, muscle, and fascia around that heel to help that first step out of bed feel less jarring. Next, we'll go over the afternoon stretches. So these are stretches that I would like you to do multiple times throughout the day. There are many opportunities to incorporate these during a workday. Try and sneak these stretches in whenever you get a chance. So first, we'll again bring our attention to the posterior calf. It's often ignored that we have two major muscles that compose the posterior leg, and we need to do 2 different stretches to target each of these muscles. This first stretch is a straight leg calf stretch. It targets the gastrocnemius. Try and hold this position for 20 seconds. Perform this stretch as many times as you're able to throughout the day. The next stretch is very similar, except the knee will be flexed. This small adjustment targets a completely different muscle, the soleus muscle. You will get a completely different stimulus and feel the deeper stretch in your lower leg, kind of behind your Achilles. So again, try and hold this stretch for 20 seconds at a time and perform this as many times as you're able to throughout the day. You can't do it enough. We save the best for last. This is the evening routine. This stretch has been named the heel yeah stretch, as this phrase was yelled out by one of my patients when he was performing the stretch, and it's just kind of stuck. So you'll feel this stretch target that fiery spot in your heel. Doing this stretch routinely at night before bed can help prevent pain and bring for better mornings. So to do this stretch, you'll find a door jamb and rest your toes against the wall with your ankle flex. Move your body towards the wall for a deeper stretch and away the wall for a lighter stretch. Play with these positions, move between deep and light stretches. Ultimately, accumulate 3 minutes of stretching in this position. So there you have it, a quick morning, afternoon, and evening routine with no additional tools or devices that you can start right away to help ease some of your heel pain. If this routine is too basic, or maybe you've already tried these stretches, move to my next video where we will go through more advanced stretches for morning, afternoon, and evening without using any special equipment.